You probably recommend warm compressors a lot in clinical practice, but you probably also have a lot of unanswered questions. Questions like, what warm compress should you recommend? An eye mask or a face cloth? How long should your patients apply the warm compress for? And how long should the warm compress be? I've answered all these questions in a summarized clinical document that you can use and apply straight away. On the top of the document, there is a box that has a summary of all the findings, and I'll be going through those findings in this video here. Warm compressors are an effective treatment for meibomian gland dysfunction. If your patient has aqueous deficient dry eye, warm compressors are not going to be an effective treatment option. One of the most difficult things with warm compressors that you've probably found yourself is patient compliance. You go through and explain to your patient why warm compressors are effective, how to do them, you recommend them, the patient goes away and either never comes back or they come back and they haven't done them. To improve warm compress compliance, the best thing that I've found is to schedule a follow-up at 4 weeks and let the patient know that you'll be repeating the measurements. And I find that this encourages them to keep up with the treatment up until that point. When you see them at the follow-up and you show them how much of improvement they've got, this encourages them to keep continuing with the treatment further up until the next review session. You've probably asked yourself what the optimal temperature is for warm compressors. The answer for this question has only been answered recently in the literature, and the optimal temperature is between 40 and 41.5 degrees Celsius. This means that a lot of face cloths and commercially available warm compressors or eye masks will not reach this temperature unless you reheat. Face cloths are not an effective warm compress method unless you use the bundle method. We'll be posting a separate video about this method that goes into how to do it in detail. You've probably asked yourself if patients actually need to massage their lids. The literature shows that warm compressors are effective even without massaging, but it is still recommended that patients massage their lids. In the literature, a lot of people recommend using a rolling method where you ask the patients to look up and roll up towards the lid margin. I find there's a problem with this in that patients end up rolling too far away from the lid margin. So the way that I recommend that patients do it is that they look up, they get close to where their eyelashes are and they just press. And they do that all the way along until they get to the edge. Then I ask them to tell the patient to look down and do the same thing on the upper lid. Doing it this way ensures that the pressure is applied close to the lid margin and not too far away. You're probably wondered when you expect signs to improve when you've applied warm compressors. The first thing to remember is that face cloths actually don't really work that well and you're not really expecting much of an improvement. When you're using eye masks, you can expect an improvement in the clinical signs after 4 to 8 weeks, but you can expect a quicker improvement in symptoms, normally after about 2 weeks.